You're like a walking now billboard for your own work. It's like, hey, like I've had this done. I know what it's like.
I'm super open about it. For the people who are coming in and talking about having a similar procedure, I'm absolutely 100% honest with them. I'm like, this was my personal experience. I've already had plastic surgery.
Oh, okay.
Myself.
There you go.
There you go. Yeah.
What would you have done?
I mean, yeah. So, and I'm super open about
Awesome.
it. For the people who are coming in and talking about having a similar procedure, I'm absolutely 100% honest with them. I'm like, this was my personal experience.
Mm-hmm.
But for me, I had liposuction and Renuvion. I had like
awesome.
360 lipo and Renuvion. And, the reason behind it is when I left residency, I was like in the worst shape of my life, just like ate hot garbage for 6 years and like never worked out. So I was probably like 15, 20 pounds heavier than I am now. And then when I moved to Portland, I had like all the time in the world because I wasn't working for like 3 months, like waiting for things to go through. So I was like working out and eating right and lost all that weight, but I was in my late 30s. So then my skin was lax. I was like, sweet.
Yeah.
So excited for that. So while I was getting settled in practice, I was curious about Renuvion because I know that you had it and Dr. Molds had it, and one of our other buddies. And I was like, well, does Renuvion work? And I feel like the best way to find out is like to be a guinea pig. So I packed up my bags. I flew down to Southern California and I had liposuction of my like abdomen and back and the flanks, like the love handles, and got hit with Renuvion as well to deal with some of those trouble areas and to deal with my lax skin. It was like super effective. Really, really loved it. I was a huge fan. So that's one of the reasons why I pushed to buy the machine for our group because I tested it out. I'm like, it's good tech.
Yeah.
Living, breathing results, right? What else could you ask for?
That's awesome, dude. What was your recovery like? Because I'll talk about myself. What I want. I'm actually having something very similar done in August. So
yeah,
I'm cool to hear that from you. But
dude, we're doctors, right? Everything gets super accelerated.
Yeah.
We don't listen to our own advice or anybody else's advice. So for me, I flew down Thursday night. We had like dinner together, like out on Thursday night. I had
nothing
surgery
after midnight.
Yeah, it was like late dinner, like steak and red wine until midnight. Then straight to the surgery center. Had surgery on Friday. I took pain meds like Friday night into Saturday, and then we flew back on Sunday. And on Monday, I was operating
at work,
like full blown, full day of operating. I had my compression garment on underneath of everything, following doctor's orders, but Tylenol only, operating, and it was totally fine.
Yeah.
I mean, it wasn't a big deal. For me, the toughest part is the compression garments I was in, like a Designs Verani compression garment, and trying to operate in that and just getting hot.
Totally.
Just trying to find out what was going to work for me was the biggest thing overall. But pain wise, really just pain meds for like 36 hours and then just Tylenol, ibuprofen. After that, it was fairly easy recovery.
That's awesome. Yeah, that's honestly, you bring up a trouble there. I think it's like you, me, and a lot of guys our age, right? Like we don't talk about it a ton. And I have a lot of male patients who come in, we do the exact same thing. It's a 360 trunk, chest, lipo, skin tightening, because we need that as well. Skin contraction with Renuvion. Secondary skin tightening. But that's what I'm having done in August. So my partner is going to be doing that. And I'm very open about that, and that's my question is like, I don't know as surgeons if we have to share it, right? Like we don't have to, but I feel like having gone through at least some aspect of what patients go through in terms of the prep, like you said, the recovery, going through all that, I think you definitely can relate to patients. But like you said, you're like a walking now billboard for your own work. It's like, hey, like I've had this done. I know what it's like. This is what I experienced, because I'm like, hey, right now it's like, well, I know all my patients, they tell me this, and I can kind of convey that to a new patient. But I'm looking forward to it. Like I said, I've gotten to my goal weight, been working out, doing things too, and it's just like this stubborn area, It's like I look at my relatives, we all have the same inner tube thing going on. I just can't, it's stuck, Oh
yeah. And the love handle area, I mean, if out of all the stuff that, all the area that Dr. Molds treated, if it was just the love handles, I would have put up the same amount of money.
Yeah.
It is worth every penny because it's just completely 100% gone.
Amazing.
And then even with some fluctuations in weight is just the waist is so much smaller. So pants fit different,
awesome.
shirts fit different. It's just, whew, no question.
That's awesome.
But with my patients, I'm absolutely a sharer of all that. I mean, whatever I can use in my arsenal to like discuss that situation, I'm an open book for that kind of stuff. I'm definitely an oversharer.
Well, I think like in today, you know, like we look at social media, a lot of the posts that we do, it's our patients are talking about their surgeries. They're tagging us as their surgeons. They're sharing with other people. And like, I don't think there's any moral obligation for anyone to do that. Maybe some people do it for their own reasons, right? Like maybe it helps build their following, or maybe they're just doing it because they want to be informative, or all the above. But I think as surgeons, I think we are in that similar category. Like in a lot of ways, you and I are influencers of patients. And so I think understanding the process, going through that ourselves, not required, but I think definitely can help our patients.